for 2022 that Her Honor the Vice President presided over, and there is a very specific resolution that came out of that Lusaka agenda, meaning health services must be implemented using one plan which is led by the government, and all partners must buy into that. 2, one budget. Everyone must put money into the same pool. And 3, we should use the same monitoring and evaluation framework. Now this is very critical, so that no partner should then start creating sideline kind of health services that go parallel to what the central governments are doing. And then secondly, we have our aim to increase domestic financing. So how are these countries going to, on one hand, implement the Lusaka agenda? We have the Abuja target of 15% to achieve. The countries in Africa that have achieved this, how have they done it? And those that are still struggling to achieve that, how can we do it? Yeah, we have a lot of things to look at. Especially, I'm happy that the budget committee is on board, because that is where the crux of the matter is. Health should no longer be seen as a consumptive sector. We should be seen as an economic sector, because we need to keep everyone alive to keep the economy going. Once a GDP improves or increases, then the allocation to the health sector definitely increases. Even per capita spending per individual increases. Now, once that increases over $86 per person in a country, you will find that the delivery of health services generally improve, and you begin to achieve as a country those milestones that you have set. And then, of course, we want to see which area in economies of these countries did they tweak in order to increase domestic financing, because this is very, very important, so that we have money. Like ourselves, we can showcase that we had a huge debt mountain, but how did we manage to do our debt restructuring? This is an important lesson for almost every African country. We all have debt, but how did we manage to actually restructure our debt in order for us to create fiscal space to implement these services like health, education, and agriculture? So it's very important that we do that. How are we triggering these other economic sectors like mining, agriculture, tourism, vis-a-vis, to see, is there any contribution that can come from health? Yes, there is. Local manufacturing becomes absolutely important. We need to manufacture our own medicines and vaccines. So there's a big drive in Africa to achieve health sovereignty through local manufacturing of medicines and vaccines. So what are we doing? Several steps are there. We've got regulators. We've created an African Medicines Authority now, that is at the Africa Union, that is now going to coordinate all the medicine regulatory authorities across Africa. We have strengthening our own regulatory authority to move from level 1 to level 3 maturity, and all that is as a result of the country's vision to achieve local manufacturing. So we have engaged the private sector to see how they can come together, and all this we have described in what we call the Health Compact. Remember, there was an energy compact recently that the president signed off and has led to all the developments that we have seen. There is now a health compact that the president signed, and we are now going to be using it to attract partners, funding, and of course, in that health compact, about, can I say, almost 70% of funding is assured by our own Ministry of Finance. That is the sure way of saying we are going to increase domestic financing ourselves. So if we can do this through this health compact, then others will come and join us and say, this is the right way to go. This is what Zambia is doing. So we expect that in this forum, countries will discuss, the parliamentarians will discuss what are these mechanisms that we can use, and come up with resolutions that every country now has to follow.
Okay, I like that you brought out the fact on debt management. And Mrs. Calloway, I'll throw this to you. What challenges does NEMA face in implementing the scheme, and what does NEMA hope to gain from the discussions just to help address the challenges?
Thank you so much. As you may have heard recently, NEMA is having quite a bit of solvents issues, which, like I've already said, we know what we need to tweak. All we need is policy adjustment, and that is where parliamentarians are coming in. So in this forum, we are looking forward to the countries that have been there longer, like I've said, Kenya and Rwanda. So we want to get what is it, where do they charge for them to remain afloat, and what is it that we need to do so as to remain resilient and self-reliant, so that we don't always look onto the donor for us to supplement, for example, the reproductive health that Dr. Nishima spoke earlier about. What is it that NEMA can do so that we continue supplementing Ministry of Health effort in line in a way that we continue supplementing in terms of budgetary deficit. Further, much as NEMA has had these challenges, there are things that we have put in place. So we'd want to learn from the region to see that whatever we're implementing right now, for example, reaching out to the poor and vulnerable that are exempt from NEMA, what is it that the region is doing in line with those poor and vulnerable? The over 65 currently, they don't pay anything on our scheme. How is the region doing it to be able to supplement contributor rate or health care payment for these cohorts? The below 18, they also do not pay currently on our scheme. What is it that other countries are doing that we can do differently? So those are some of the challenges NEMA has currently, to funding of the poor and vulnerable, the over 65, the below 18 who are dependents. So we want to learn, because clearly these are poor and vulnerable, and they need healthcare services for us to reach the universal health coverage. So how are they doing it? We can't throw them. How are the other countries doing it? And then we also want to have a collective voice in the region that will help us to come up with one thing, that when the region speaks, other countries, also other leadership in the individual countries are following. So that way, with the collective advocacy, I think we'll be able to achieve universal health coverage.
Okay, and I get to you, Dr. Lishimpi. What message would you like to share to the delegates that will be attending the 17th Neapacoh Forum, and of course all the other stakeholders that will be participating as Ministry of Health? What message would you like to send?
First of all, is a message of welcome to all the delegates to this particular conference, and to give a message of congratulations to the Parliament of Zambia for having accepted to host this conference, and just to say we are looking forward to the deliberations, and we expect that a very unique Africa led decisions will be made, and with resolutions that resonate well for the continent. Okay,
and Mrs. Calloway, any flagship message that you have, or program that you have for the 17th Neapacoh Forum as NEMA?
Yes, please, and indeed NEMA has been given a slot to do a presentation, so that, like we have already always been doing 2024, 2025, so that we tell a story on how our design, NEMA design was, what challenges are we having so far, what are we doing at the moment, and so we will be having a presentation around that area to tell a story on when NEMA started, what studies did we do, from those studies, what benefit package are we offering the public, what about our contributory rates, and what are the policy reforms that we are seeking from the parliamentarians. So we'll be doing a presentation around that. So we're looking forward to this meeting, and we are grateful indeed to firstly the local parliamentary committee for recognizing NEMA to be part of this meeting, and to Neapacoh in general, and indeed PPD, who have always called upon NEMA to tell us their story to the region, so that other countries can leverage from what we are doing right and that which we are doing wrong, that collectively we can shape the health financing to the desired perspectives.
And Dr. Lishimpi, any flagship message that you will have given a platform to present at the Neapacoh Forum as Ministry of Health? What message would you give?
Well, this is we hope to deliver a transformative, impactful message that speaks to embedding universal health coverage principles into our health system for us to have a resilient, responsive, and efficient health delivery system, so that we achieve universal health coverage by 2030. And of course, looking at strengthening the systems that govern primary health care for us to achieve all these things. And so we are looking at strengthening the financing to these health systems so that we can achieve, because like you said earlier, this intersection is now, you cannot separate health from finance. It is now, they are twinned, and that is the message we are giving. For us to be impactful, we need to deliver these health services. But from the other side, they'll tell you, we have limited financing. Can you deliver the health services that are impactful and more of these with this limited envelope? So those are the areas that we should look at and say, can we do it? If the answer is yes, how? So we believe this can be done.
Okay, and Zambia has also been making strides in boosting tourism. As the Ministry of Health, how are you going to boost health tourism during this forum?
Okay, first of all, we want to ensure that every attendee of this conference is healthy, and so we have health clinics that are set up to ensure that the attendees of this conference are attended to. But we can showcase what specialized healthcare services do we offer in Zambia. We have the National Heart Hospital, we have the Cancer Diseases Hospital, and we have several other services like kidney transplants that we've started doing now in the country. And so we will probably showcase those and see how we can then attract people from other countries to come and learn from Zambia and bring their patients here. Secondly, she said that we need to look at policies on how we can tap into the minimum 1 million tourists per year that we want to attract into the country. You've already heard the Ministry of Tourism say they went over that target. They're almost at 2 million. So when these tourists come, how is their medical service being provided? So we've got NEMA. Can we say we build it in so that these tourists, as they are getting their visa, they've already paid for their NEMA during their stay in the country. So this is important. This needs policy shifts so that we can see how we support the tourists whilst they are here, in terms of they should be assured when they fall sick, there will be hospitals to look after them.
Okay, and as we get to the close of the program, Mrs. Calloway, from NEMA's point of view, what new reforms can Zambia expect from NEMA following the 17th Neapacoh Forum?
Thank you so much, Teresa. So like we've said, we're looking around the issue of extra funding, of course. How do we leverage on the parliamentarians to help us have a unified voice towards the funding of these national health insurances? How do we look at the poor and vulnerable? Currently, we've got the social cash transfer, which had 1.3 million households. Now, we heard from the president that we've increased to 1.5 million households. These families are being funded for their food, are being funded for other social amenities, but we are looking forward to a point where part of that arrangement, probably NEMA can come in to either tap directly from that resource envelope or have a line that will be able to take care of the health of these 1.5 million households. Because once there's health component captured in that particular 1.5 on the funding that goes towards the social cash transfer, then you have a complete set. Because trust me, these households, we've currently done a mini pilot using Global Fund, where Global Fund has funded the contributions for the 20,000 plus social construct beneficiaries, just to try and see that out of that number, how can we then expand so that the 1.5 million households that are sitting under social transfer are also covered under NEMA. And once we do that, if we capture the 1.5 household, then we'll have about 8 million lives that will be under NEMA, and then we are reassured of getting closer to the universal health coverage. Because it's these poor and vulnerable that are very vulnerable. You and me probably were in some private insurance of some kind, but these poor and vulnerable, the over 65, they are the ones that we must pay attention. And we're looking forward that as we engage with various regulators from the region, our parliamentarians, that some of these ideas should start being discussed to see how we can widen our scope as a financing mechanism that we have in the region. Thank you.
Okay. And Dr. Lishimpi, what long-term impact do you think the Neapacoh Forum will have on Zambia's health system?
Thank you very much. The long-term impact is the realization of achieving the SDG goals. Because if we all agree, how do we then, from where we are, I'll give you an example, maternal mortality. We managed to reduce it over the past 4 years from 252 per 100,000 live births of women dying to now 187 at the end of 2024. So the target is to be less than 100 women dying per 100,000 live births, right? So how do we restructure ourselves in terms of getting it from 187 to less than 100 in the remaining time before 2030, so that we achieve this? And then child mortality, if you look at neonatal mortality is a good marker because it has reduced from 27. It had been constantly on 27 for a long time, and in the last 4 years there's a sudden drop from 27 to now 17 per 1,000 neonates being born live, right? So we are losing 17 out of 1,000. So we want to lose only less than 12 per 1,000 live births of those small babies that are born. Now, these are not just statements. They come with a lot of activity under them. Say like for maternal mortality, we know that they are grouped in 3 categories of factors that cause increased maternal mortality, and we've identified all those for a long time. We have known, but the problem has been, how do we intervene? What is the best vehicle for intervening? All the general kind of things that we have implemented have caused us to come to this point. Now, this now requires ingenuity, country-driven solutions, specific solutions from here to now achieve what you need. 1, maternal dedicated health workers who are specially trained and deployed to make sure that we are reducing this. 2, what systems are we going to use? Where are the community ambulances? We've never had them in Zambia. So is it possible we can have them? The answer is yes. How are we going to organize it? Through a digital platform to strengthen the district core centers? We can do it. We've got Yango. So why can't we do it in the medical side? So these are the kind of the things that are in our health compact. And when you see it, you'll be able to say, okay, if we implement this, it's an amazing time that we are going to go through in the next 5 years or so, that is going to actually put a community health worker responsible for a certain number of households, and they will know everything about health of the people in these households. And the Ministry of Health, including NEMA, shall know that this household is not under NEMA, this household is on NEMA, so what are we going to do? So all these things are vehicles which we are going to use to ensure that we succeed in what we are doing. So this particular conference, the long-term effect is that it will set the scene for all these things to be implemented. There are certain African countries that have already done it, and we are going to learn from them and then put it on ours and say, here it is, this is how we are going to do it.
Okay, I must say thank you very much, Dr. Lishimpi and Mrs. Calloway, for making an appearance ahead of the 17th Neapacoh Forum, which Zambia will actually be hosting this Wednesday. And earlier on I did mention that the Ugandan Secretariat is already in the country, which shows that the momentum has already been built up. We do expect a lot from this forum, and we hope to meet you and just get to learn more during the forum. So to our viewers and listeners on Parliament Television and Radio, and our followers on our social media platforms, that's the National Assembly of Zambia Facebook page and YouTube platform, this has been Taz Piri, and on behalf of our sign language interpreter Chola Kauma and the entire production crew, we wish you a lovely day. Continue watching Parliament Television.